Good afternoon, St. Lucia. It is Thursday, the 19th of November. We just want to say thank you for joining us. My name is Doreen Georges, and in studio with me is Rondell Shalry. He's the Public Relations Officer at the St. Lucia Tourism Authority. We also have Mr. Pakna Ragnan, our Chief Environmental Officer. And before we go into this afternoon's discussion, really on our tourism protocols and what it is we'll be observing over the next few weeks, where the ARC is concerned and several other topics, we just want to say good afternoon to all of our men. Today we celebrate International Men's Day, so we just want to say thank you for being the strong figures that you are in our society, and we want to continue to help to motivate others who are really looking forward to advancing and taking that positive step in society. Good afternoon, gentlemen, and thank you for joining us here on NTN.
Good afternoon, and thanks for having us.
Thank you for being here. So we're going to start the discussion with Rondell. Rondell has been very instrumental in assisting the team at the Ministry of Tourism as it relates to the screening and certification process for various sites and attractions. I believe Rondell has also been very much involved in terms of certification and screening as it relates to some of the hotels. So I'm just going to let Rondell tell us a little bit about that process and what it is that is required for certification during this COVID-19 pandemic.
Thank you, Doreen. With the screening of hotels or sites and attractions, one would have to show their interest in reopening. It's been a difficult time, and it's a rigorous process where they would have to present a COVID action plan. In that action plan, they would have to show their protocols, how they would handle a crisis, social distancing, how they are going to undertake that. For properties with food establishments, they would have to go further by involving environmental health. Upon receiving that action plan, we at the Ministry of Tourism would review it. We would also do a site inspection where we will evaluate and make recommendations. Hand sanitizers, social distancing, markers, signs, face mask signs, evaluate the bathrooms and toilets, ensure that the sites and attractions have showers for the employees, because we'd like to ensure that the staff and the wider St. Lucia population is safe after the sites and attractions have received the guests. So we'll do that. We'll give them some time based on the recommendations made to make the changes necessary, and they would reach back to us and we would go for a second visit. Upon that second visit, we'll determine whether or not we will give them the certificate or not, or further work with them to ensure that they can reopen. Similarly, for the hotels would be something similar, where we'd go in to make recommendations, work with them on their COVID action plan, and make recommendations and go to continue doing visits with them.
Thank you, Rondell. And I know that the team has been on the go. To date, we have 64 properties that have been certified for operations.
Yes.
There are various sites and attractions that have been opened. I know several protocols have been put in place, including visitors being able to use the properties during the week and locals on weekends, so as to avoid that level of intermingling and so on. We've also seen an increase in flights from the various markets. As much as we've seen a closure of the UK borders, we understand exactly what is happening. Measures are being taken to ensure that their jurisdiction is also protected, like we are doing in St. Lucia as well.
Yes. So one of the things that we've have been able to identify, the Ministry of Health and Ministry of Tourism would like to prevent the commingling of locals and visitors. So each site and attraction, would have to present a schedule. On that schedule, they would have to say when they're accepting guests and when they're accepting locals. Also, with the guests, a visitor from one property will not like them to mingle with a visitor from another property. So they will set schedules. Everything has to be pre-booked, both for locals and visitors. They were trying to avoid walk-ins for the sites and attractions. And we'd like locals to please call before you try to visit a site and attraction to make it simpler. So yes.
Let's hear from you, Mr. Ragnanan, on these protocols as well.
Yes. Thank you, Joreen. And I just wanted to say that apart from the protocols, one of the requirements for the accommodation sector is to do with a public health license. It's actually one of the prerequisite requirements. And that is based on the public health regulations, the Public Health Act with certain regulations. One of the key regulations is the food safety regulations. There is also the swimming pool regulations. There is the barbershop regulations. There is also the regulations for apartment houses, guest houses, hotels. And very often the issue of licensing comes up because it is, like I said, one of the pre-requirements in terms of ensuring that the public health license is first in place before you can actually get the certification, the COVID certification that we speak about. So I wanted to mention that. Further, I want to make a special appeal to all business places that when license payments are being done, if checks are being submitted as the payment, it must be addressed to the accountant general. And also, we have offices at Bois-d'Orange, Soufre, and Vieux-Fort. There are offices there that you can physically go to these offices and be able to make payments and be in a position to make these payments. So I wanted that to be very clear in terms of the procedure for obtaining a public health license. There is a prescribed application form that you must send your application in. An assessment is done of your facility to determine whether you have met the public health requirements to enable for licensing. On top of that, we are looking at the second tier of certification, which is really the COVID certification. So apart from the public health license, there is need for you to do a COVID action plan. So what has happened is jointly, there is a protocol that has been established and developed, and that has been done with a wide cross-sector collaboration. It's not just Ministry of Health or Ministry of Tourism doing our thing on the side, but it's a protocol that have been developed with a lot of input from the industry. And so this protocol must be used as a guide to developing your own response protocol. So we would expect every property to have a protocol. One of the things that we are seeing is that there are so many different types of businesses in the accommodation sector with different facilities. So you have some businesses where there's swimming pools, some no swimming pools. There are some with large rooms and high volume rooms, and there are some with 2-3 bedrooms. There are some where you have eating facility is present and some where you have no eating facilities. That means there's not a central food preparation area. You may have a room that has a kitchenette as part of that room, but there is not a restaurant and a kitchen on the property. So there are different variations in terms of the type of properties. And that is why the assessment is done to ensure that the best approach is implemented. So the protocols are not set in stone, but they are a guide to help properties to develop their own response protocols, and these must be submitted. And I want to say that a protocol is one thing, but for us, more than the protocol is actually the implementation. And so we are looking at how you implement what you say you're going to implement in your protocol. This is very, very important, because very often what is on paper does not necessarily translate to what is in practice. So the assessments would also make a determination to ensure that what is on paper as part of the protocol is seen and is being implemented. And there's constant monitoring of properties to ensure that this really happens. So I just wanted to add to what Rondell has already said.
Absolutely, and you've touched on it. I was about to ask about the monitoring processes and so on. Let's touch a little bit on ARC, Mr. Ragnanan. We know that St. Lucia has announced that ARC events for 2020 will be observed. We know that ARC Plus has left Las Palmas as of Sunday, the the 15th, I believe the date was. They're already en route to St. Lucia. ARC will depart Las Palmas on Sunday, the 22nd, en route to St. Lucia as well. I believe we have a combined total of 454 crew members, 37 of which are children, all coming from a combined total of 137 nationalities. And as much as it is far less than the numbers we have seen in previous years for ARC, we just wanted to touch on some of the protocols that would be observed for the ARC, more or less to give a level of reassurance to the public in terms of how the health and safety will be observed. We know that a lot of thinking has gone into the process, and of course you must evaluate at what point it is you begin to rethink events. And for us, ARC 2020 was that start point in terms of events. So let's just hear from you in terms of the protocols.
Sure. One of the things that we did very early is to work with the marinas on the island. So first we established protocols with the marinas. As St. Lucia would recall, for a number of months, our seaports were closed to cruise tourism and leisure tourism as well. So our borders, so that means our marinas, our seaports were closed. It's incidentally, as we speak, the Cashville seaport is still closed to visitor tourism, cruise tourism, and so forth. And to date, we have not been able to have our ferry service reinstated. But St. Lucia, a few months ago, reopened our borders in terms of receiving yachts, the leisure craft as we'd call them. And there are very strict guidelines that we work with the marinas on in terms of their protocols. So what are some of the things that we had to look at? And I'm saying that so that we can understand the background of where we are in terms of going with ACT, so we can tie it in together. So the marinas worked closely with the Ministry of Health and Customs and Excise, SLASPA, and other agencies in terms of looking at the approach. What we have seen is we have scaled up our port health surveillance at the marinas that are opened. Then there are very clear guidelines. One of the things that was taken into consideration in terms of reopening the borders for leisure craft had to do with quarantine. And at this point in time, there are two options, basically, for quarantine persons who come to the island on yachts. One of them is to be quarantined on board the vessel. Now, these vessels, they have rooms, they have kitchens, they have facilities, and so it's possible for you to be quarantined on board a vessel. The other option is to be quarantined at a certified quarantine facility. And so these are the two options that have been given to the leisure crafts in terms of an arrangement for quarantine purposes.
All right.
If, for example, a yacht decide that they want to use their vessel for quarantine, there is a demarcated place at the marina that these vessels go into, and there is the security and the surveillance officers to ensure that it remains at that particular location.
I believe we commonly refer to it as the quarantine dock.
Yes. Further, what we have is the medical personnel, the port health personnel, who would from time to time be doing the medical screen, the checks, the temperature readings to ensure that things are remaining within the acceptable standards. If anybody is found to be with elevated temperatures, symptoms of the flu and so forth, then they would be referred to a medical facility. And that has happened. So these were some of the basic arrangements. Further, we have looked at the whole issue of waste management, which is a big thing at our marinas, and how waste, whether we talk about solid waste, liquid waste, is managed. And all of these form part of a protocol for marinas. That brings us into the ARC. One of the things that we have seen for the ARC is, in the past, we've been told that the fastest that somebody has reached is probably within 10, 11 days from departure.
About 9.
Yeah. So, but generally what we have is a period of about 2 weeks, generally, that it takes. One of the requirements for St. Lucia is that all persons who are in the ARC event this year they would do a PCR test before leaving their port.
That's in Las Palmas?
Yes,
Okay.
and coming across to St. Lucia. So that is one. Secondly, every yacht must submit a maritime declaration of health. So it means that before the yacht gets to St. Lucia, we would need to get a maritime declaration of health, giving an indication as to the general status of the health of the occupants of that vessel. So you have the maritime declaration of health, which is a legal mandatory requirement. Then when persons get to St. Lucia and when they have been cleared, so there's going to be a screening process that persons must go through as we have at our ports. So they would be doing the temperature checks, they would be doing the medical evaluation, and they would be determined as to whether they can be given clearance or not to berth in our ports. Secondly, apart from the maritime declaration of health and the test that we've spoken about, some persons may be subjected to doing a second test, depending on the individual case that presents itself. So we are looking at that too as an option to doing a second PCR test on arrival in St. Lucia. So that too is one of the things that we are actively looking at. The other thing is, we've been told that apart from persons coming in on the yachts, there may be persons who are flying into St. Lucia to join with their family members. And so persons who are flying into St. Lucia would also be required to do a 14-day quarantine before they can actually be authorized to join up with their family members. So all of that is in place. So we're working with the Marinas in terms of their own protocol. We're working with the event organizers in terms of the additional protocols that we want to put in place for the ARC event. And we are also working with the hotels, with the quarantine facilities, ensuring that there is a seamless process to facilitate the ARC event for this year.
Okay. Now, as it relates to the numbers and mass crowds and so on, how will events in terms of the ARC be managed? Would they still be guided by the same numbers that are in place for mass crowds?
So now it's a little bit too early to speak about the numbers, because we know that this keeps changing. So for example, maybe 3 weeks ago, the numbers were 50.
Correct.
Today it's at 25 for a mass crowd activity. We don't know what the status in terms of the country. And so when I speak of the status, I'm talking about in terms of where we are going to be maybe 2 weeks from now in terms of the number of cases that are active, because this is one of the things that determine the measures that you implement. And the more cases you have is the higher the risk, and therefore you need to take stronger measures to ensure that persons are not infected. So we are still looking at all the options with the event organizers. But clearly they have indicated to us that some of the events in the past, some of the activities, they can no longer go along with these events because they clearly recognize that the risks are high. And so we are looking at their meetings at different intervals from time to time, that discussions are happening in terms of the side events for the ARC activity. I'm not aware that a final decision has been taken on them. But clearly, if we continue to have the transmission and the spread of COVID-19 that we have now, we definitely have to look at limiting numbers in terms of how many persons can be at a particular event at any one time. There may also be a need to cancel events altogether. Again, that is in the works, but as we get closer to the actual events and in the context of the national picture, then we'll be able to make that determination of how we move forward with some of the events.
From an environmental health standpoint, are there major concerns at the moment in terms of the number of cases and what the projection could be like?
Yeah, I think we are concerned. Every single case is a source of concern. As we know presently, there is yet a vaccine. I know there's a lot of talk about some vaccines that are close in the making, but the truth is we do not have the vaccine at this point in time. And secondly, we do not have the cure. So apart from the vaccine to immunize persons, there's not a cure. So it means that persons are still dying from COVID. The other thing is, we are seeing that in St. Lucia, this second wave has really affected us as a country. So we are very concerned every time we get a new case. Every time we get a new case, it's putting additional strain on the healthcare system, additional strain on families, on individuals. There's also the mental health component of it for persons who may have unfortunately contracted the disease. But so far, I think we are seeing very good signs in terms of the numbers that are recovering. But that does not mean that we should not continue to take the precautionary measures to prevent the spread, because it's going to be important for us to put a halt to the numbers that are getting ill. We're seeing that infants as young as 1 year, for example, have reported to have contracted the disease. And we have some of our senior personnel in the 80s who have also contracted the disease. So we are concerned as a country with the spread at present, and we continue to appeal to the entire population that we need to undertake the basic measures. They may seem simple, but these are the simple measures that would protect you and protect your family. What are they? Wearing a mask. Persons many a times refuse to wear masks in public. Hand washing is important. Get a little bottle of hand sanitizer with at least 60% alcohol to sanitize your hands where there's no water for hand washing. The physical distance, and one of the things that we're seeing very often is people socialize and they do not pay attention to the physical distance barriers. These are some of the things that we want to continue to implore all St. Lucians to pay regard to taking the basic steps. They are basic, they are simple, but they are difficult sometimes to really do. But we need to put our minds in the frame to wanting to do them, because one case is one case too many. Unfortunately, we have had deaths as well in St. Lucia, and we know COVID kills. So again, we want to appeal to the entire population of St. Lucia to take their safety measures to protect your own health and the health of your family members and friends in order to control, and I would hope that we can prevent the spread of transmission of COVID-19.
Thank you, Mr. Ragnanan. And other tourism updates as well. As of yesterday, it was announced by the Ministry of Tourism in collaboration with the SLTA and the SLHDA that effective December 1st, a tourism levy will be applied to visitors arriving on the island. That tourism levy is an amendment of the St. Lucia Tourism Authority Act number 8 of 2017, and that will apply to visitors who are between the ages of 12 to 17 years old, being responsible for 50% of fees. Below 12 years of age, fees will not apply. And of course, adults, the fees definitely would apply. The fees would range between, it would be $3 for rooms that are less than $120 US per night, and $6 for rooms that are above $120 US per night. And of course, with that, the St. Lucia Tourism Authority being the collectors of that levy, the hotels pretty much would be the collectors of the levy and remitting to the St. Lucia Tourism Authority. And these funds would be definitely used for the marketing and promotion of the destination. Effective December 1st is the date, and so we pretty much look forward to working with our hotel partners going forward in terms of the registration process and what can be observed in terms of the implementation of the levy moving forward. Of course, the St. Lucia Tourism Authority will continue to do all in its power to market the destination in terms of the various niches. Romance for us is a very big one. Adventure, family, health and wellness. We know a lot of people focus on dive as well. So for us, there are various niches that we really market the destination with and will continue to do so. Annually, a subvention of about $35 million is allocated to the St. Lucia Tourism Authority. And so we've heard our government officials indicate that that subvention will now be used in other areas of healthcare, education, and national security. And so we look forward to what these funds can do for the development of the country, while tourism pretty much generates its own for the marketing of the destination. And with that, I think we will move to final words from our guest. Mr. Parker?
Yes, so again, I want to appeal to our St. Lucian public that we pay attention to what is happening around us. Very often we are caught up with misinformation. We at the Ministry of Health at all times seek to bring you the information that we have. And therefore, we are appealing to all of St. Lucia to pay particular attention in terms of the prevention of COVID. Over the last 3-4 weeks, we have seen a rapid increase in the number of cases that we have on the island. And we are concerned, and I know you are concerned as well. We all need to play our part. We all need to take in personal responsibility. And therefore, I just want to appeal that we would allow good sense to prevail and that we would do what is the best for us and for the country. And therefore, I continue to implore you to ensure that the COVID measures are implemented, that you are doing your part to prevent the spread, and that you would continue as it is to adhere to the advice given by the Ministry of Health. And if you have additional concerns, you can call us at 468-5300, and we'll be happy to respond to your concerns. There's also the 311 line that you can call into as well with your concerns. So with that, I want to thank you, and we look forward to a good ARC event for this year, and we'll continue to do our best to keep St. Lucia safe. Thank you.
Rondell?
I'd like to reiterate what Mr. Parker is saying. Let us please continue to adhere to the protocols set by the ministry and the government officials. It's not to try to deter us from having fun or anything. It's just to protect us and our families. Let us continue to also stick to listening to the news from the official sources and not always social media, because we can clearly see that there's a lot of fake news happening out there on social media. So let us continue to follow the Ministry of Health and the other government agencies that let out news. So let us continue to adhere to the protocols, and let us all be safe. Thank you.
Thank you, Rondell. And just for those who could be tuned in from the diaspora, we just want to remind you that for all your travel registration and protocols for travel into St. Lucia, you must visit www.stlucia.org/COVID-19. And that is where you would be able to obtain your travel registration form, upload your PCR test, and get all the information that you would require from the frequently asked questions. So we just want to encourage everybody to make use of that platform. It is very important amid travel into St. Lucia with the COVID-19 pandemic. So we just want to say thank you to everyone for tuning in. Thank you for staying with us, and happy International Men's Day again to all of our men on island and to those tuned in. Thank you again to our guests, and we'll see you again next time.